Sir Sujita, is it audible? Hello?
Yes, sir, I can hear you. You're audible, sir.
Okay, sir. Okay, sir. Then okay.
Sir, can you hear me, sir? Neil, sir, can you hear me?
I can hear you.
Yes, sir. Sir, you can share your PPT, sir. We'll get it ready. I'll start admitting the participants once you have shared your screen.
Okay, sounds good.
Yeah. Neil, sir?
I'm just sharing 1 second.
Yeah.
Right here. All right. Can you see it now?
It is visible, sir.
Okay, wonderful.
Sir, you will have a more option at the bottom. Can you please select that option, disable participant annotations?
1 second.
Good afternoon, Neil, sir.
Good afternoon.
Rajkumar here, sir. Good afternoon, sir.
Hi. Hi, Raj. Yes, so I have done mute participants upon entry. Yes.
Mute participants annotation.
Annotation. Okay, let me see where that is. So here it is showing allow participants to share screen, chat, rename themselves.
No. You have an option called more. In that, you will have this option of you will disable participant annotation will be there as an option and more.
Yeah, I clicked on more. It is showing me chat, pause recording, stop recording, optimize screen share for video clip like that, but not the one which you are telling me.
1 minute, sir.
Sure.
Okay, fine. Okay, done. That's okay, sir. Since I have made it as a I have made you as a co-host, it will not be an issue. Nobody can annotate.
Thank you. Anything else for me to keep in mind?
Nothing else, sir. So your last slide, which says thanks, you just keep it until the webinar is over, sir. Because if you stop sharing, other people will be able to take over the share option. So
Sure.
let the last slide be there till the end of the webinar.
Okay, I'll do that.
So are you coming up with the video or
Yeah,
just?
yeah. Yes, can you see my video now?
Yes, sir. You are
Oh,
visible.
wonderful, wonderful.
So we'll start by sharp 3.
Okay,
Since we have announced it as 3, we'll have participants inflow only by 3, sir.
okay, sounds
Yeah.
good.
Sujit, shall we start? Otherwise, we will wait for some time.
We'll start, sir.
Okay, we will start.
Yes, sir. Good afternoon to all the participants. This is our 16th webinar of SRM COVID awareness webinar series. And here we have our speaker Neil Med sir and Rajkumar sir as our moderator today. Over to you, sir.
Thank you. We welcome Mr. Neil Mehta, leads the healthcare technology projects across the Adani Group, the second largest conglomerate in India. He is the multi-faced serial entrepreneur with over 8 years of experience in digital health, leadership, and healthcare innovation. Neil enjoys collecting stamps, attending concerts, high-fiving DJ Kaho, right? Am I right, sir?
I go.
Okay, I go. Okay. And flexing his negotiating skills. Okay, we welcome you for the webinar side. Now over to you.
Good afternoon, everyone. Thank you, Sujit, and thank you, sir, for the kind welcome and introduction. So today we have about an hour or so. So for the first half an hour or so, I'll go through the digital health transformation, and then please start compiling your questions or start taking notes for anything you have. And so towards the end of it, we'll have a quick Q&A, and then hopefully you will learn something new and different today, and then walk away with that. So we'll kick it off. So a little background about me before we begin. So currently I'm a manager at Adani Enterprises Limited, where I oversee the healthcare transformation with respect to all the projects where we empower employee and our physicians across 22 different businesses, 43 different sites across pan-India and also international. Along with that, I do a part-time consulting with as a health expert at Clarity, where I advise, guide, and mentor teams, especially in the startup arena, who are looking to build a sustainable solution and grow from there and have a market-wide adoption. And on the top of it, I do speaking, public engagements, as well as act as a mentor to different student teams so that they can kind of connect between the academic learning and the practical application. Over the past 8 years, I've been fortunate enough to get some recognition and accolades. I have led my own startup and exited last year, and it was in the field of epilepsy. So we'll talk about that more during the journey of over the next 30 minutes. So we'll start. So this might be a new concept for a couple of you, as I had a discussion with the faculty yesterday that about a couple of you guys are from engineering discipline and a couple of you are from biomedical biotech discipline. So you may not be familiar with a concept called digital health. But I'm pretty confident that over the last 43 days since lockdown, we all are aware about how we are working, living, and also engaging with our, faculties, with our client partners, with our businesses virtually, right? So whenever you do anything virtual, that is called digital. And then whenever you do digital, whenever you do something virtual to take care of the patients or to take care of your health, it's called digital health in simple language. So it's a broad scope. It encompasses like biomedicine, mHealth, which is a mobile health, anything which we use in the form of applications on our smart devices, and also the information technology, which enables us to have a communication. Just like this afternoon, we have Zoom, where we are able to communicate, or where I'm able to communicate with all of you guys, and soon you will be able to communicate with all of us as well. So moving on, we all are gathered in this room because we believe in innovation. Correct? Correct me if I'm wrong. Why are we spending, an afternoon here learning something new and different? Because we want to get to know, okay, what is something I don't know, or what is something which is different, or how I can add skills to my existing learning. So I believe that all of you guys, all the participants, and as well as the faculties at SRM are innovators, right? Putting together this webinar series so all the students can get to know about different facets with respect to healthcare and digital health. And so we are pioneers producing better outcomes. Look at it, like in the last over a month and a half, we have produced PPEs, we have produced like N95 masks, which we never did back in India for a long, long time. We always used to import from other countries, and now we are becoming self-reliant. We are becoming, we are doing frugal innovation. That is the core competency what we have, and that's why I consider that all of us are pioneers. We just have to figure out what is our passion and how we can just channelize that into form of a proper energy. So, but all these things like come with like unique challenges, isn't it? Like if it would be like so simple to fight against the COVID-19, if it would be so simple to find a vaccine for that, we would have done it like in 2 days since the inception of the COVID-19. But it's been over 3.5 months and we are still battling. Look at all the leading pharmaceutical companies, biotech institution, our government of India. We are all coming together to fight this unique challenge so that we can provide a good and quality healthcare to over 1.3 billion people in India and across the world. But how can we change that? So technology is one of the ways, a platform through which we can enable that at a lightning speed. Like these disruptive technologies are going to make a big difference over the coming times. Connecting patients to the doctor, connecting pharmacy to the patient, connecting, payers, which is called insurance companies, to the hospital systems, a doctor to the staff, nursing staff, which is like healthcare workers, communication, so on and so forth. So with the onset of so many smartphone and smart devices, it is estimated that by the end of this 2020, there will be over 50 million devices which will be interconnected through the web. And what is the best? And this is the best way for us to connect, collaborate, and also co-create something which can be revolutionary using digital health technology. So how can we do that? It's like something where we encompasses like digital natives, which is a little bit complex subject, which I'll explain you in a minute. And also with the increased spending of the patient population, like now days are gone that you will not come across people who are not having like smart devices. You go to second tier cities, you go to villages, and you will see people are using smartphone because that's the instrument for them to gather data, to gather information, to gather understanding as to what is happening across the world, and that is available at the fingertip. So that's the massive revolution which we are going through in the field of like digital health. And because of all this information available at the fingertip, we are able to empower our consumers, we are able to empower our patients, and that is a great way for them to take ownership of their health. It will be so amazing for our patients to understand, okay, what is going on, how can they get better, what are the things to avoid, and then have that self-realization and self-learning to transform the way we live in the coming times. And so that's the thing what our patients are expecting today. Our patients also expect higher level of personalization. Days are gone when you can just do a cookie cutter approach. That is like a physician will see over 150 patients a day and just prescribe very similar medicines, be it or not, because back then we didn't have so many comorbid conditions. Back then there was no complexity in terms of like diseases, but with the proliferation of like globalization and mechanisms and DNA mutations, including virus mutations like COVID-19, we are seeing a lot of challenges in terms of like treating patients, triaging patients, in terms of providing them with proper medications and so on and so forth. So that personalization, one-on-one understanding of that complex medical science is the need of the time, which is creating the demand of the solution. So how can we do that? Because the traditional model is no longer going to align with what the new consumer market is. Like especially the millennials and the Gen Zs like us want. We want all the information available, which is unbiased, which is not untrue, which is also evidence-based, and also directly applicable just to me or just to you personally, right? It should not be like that, okay, if it is working for one person, that means it will work for the other person. There has to be a chemistry through which we can differentiate the learning as well as the application of the medicine. And so what can we do as the demand is growing? If you talk about healthcare about 10 years ago in India, there are hardly any employees or any individuals who will go for their annual health checkup. There was no concept like that. We got that concept from the Western world, where the focus is more on the preventative, the focus is more on active healthcare monitoring. And that is becoming a standard norm, including my company and other big companies across India. Now a mandatory annual health checkup is required by all the employees, all the contract workers, as well as all the faculties, so that we know, okay, what this individual is going through. If everything is normal, it's good and great. But if something is abnormal, then we have to figure out, okay, how can we avoid becoming that as a catastrophic, right? If we are able to predict cancer at like level 1, that is much better than finding at the end stage, life ending cancer stage, right? If we are able to identify glucose level or the HbA1c for the diabetic at before it becomes abnormal, that is powerful, because from that data, from that information, we are able to get actionable insights. And through information like digital health, we can communicate that back to our patients, communicate back to our providers, and see how that communication can evolve. Days are gone when a doctor will just prescribe a medication and a patient will just take as is. Now I've seen personally firsthand that like a lot of individuals are asking question, hey, why this medicine, why not this medicine? Okay, what is the purpose for me to avail this rather than doing something alternative, in terms of like the medications or in terms of the lifestyle modifications. So those are the things which we have to keep in mind as we move forward. And all these things what I'm talking about will collate or will come together, will converge when I start talking about COVID-19 in a little bit, because the patients are no longer needing to be accepted the way they are. They want the empowerment, they want the power to take the charge of their lifestyle, to take the charge of their health. And we are seeing cases every day. So as I mentioned, we have amazing technologies across the world. We have information, at our fingertip. But why there is no adoption? Because we lack human inertia. One of the studies, and I have the source for that there are over 97,000 digital health applications on our smart devices. Just type health, go to your app store, go to the Google Play and type health, and you will see tons and tons of apps being developed by innovators like student innovators, like faculty innovators, as well as industry champions who want to take one of the specific problem which they have faced in the past, or which they know that this is a painful challenge, and then transforming that into a clinical application which becomes suitable for all the common people who are facing that same challenges. But despite having so many amazing tools and technologies, only 25% of them are getting implemented, right? Only 25% physicians are using a digital health app. This is the data before COVID-19. Of course, it has evolved over the past 2.5 months, that more and more physicians and as well as faculties are coming on board and using the tools which are helping patients. So now with the onset of COVID-19, necessity is becoming the mother of invention. As like Charles Darwin said, and we all have studied back in our high school or middle school, that, survival of the fittest. If you're not fit, you will not be able to survive. And that is what we are seeing with COVID-19. If you see the mortality rate, it's about 65 years of age, where those individuals have been facing other comorbid conditions. So that is an insightful application through which we are able to understand that, okay, now even if you are like 20, if you are 25, if you are 45, it is the time to take action. You can no longer be overweight, you can no longer have any other conditions like diabetes or hypertension or things like that. And if you have those conditions, you better monitor on an ongoing basis, so that you can avoid getting into the catchment of like the COVID-19 virus and come out on the other side with the next life, or with like something very fruitful and meaningful to look forward to. And that is only possible through portable and digital health solution. If I have an application at my home which is monitoring me on a continual basis, understanding my heart rhythms, understanding my brain waves, understanding my glucose level, and understanding and monitoring my hypertension, now I feel confident and safe that okay, even if I'm working 24/7, or if I have to do extra work for science or for research, if all my vitals are coming out to be okay, I can continue pursuing that. So identifying how to create alert mechanisms is the need of the time. And we are able to do it through telemedicine, like robotic monitoring in hospitals, home testing kits, which are coming out in India and have come to some of the major cities like Ahmedabad and Mumbai, where the cases are some of the highest. And also the chatbots, which we have seen in some of the hospital systems, which we are using, including the Apollos of the world. So how can digital health technologies can help mitigate the the spread of COVID-19, or it is also helping at the same time as we speak, is through use of all the tools and technologies which I have written on the left, starting from telemedicine to machine learning to health sensors, and AI monitoring, cybersecurity, and so on and so forth. And all those things on the left is encompassing one or the other thing on the right. So diagnosis, treatment, and so on. So I'll take a moment and show you that if we talk about telemedicine, it is helping us with the diagnosis. If we talk about telemedicine again, it is helping us with the treatment. If we talk about telemedicine again, it is also helping us with information gathering as to what patients are facing when they are home or when they are away from the physicians. And hopefully I'm able to go through this and kind of show you what is the power of digital health and what is the power of information technology into the healthcare ecosystem. So, and some of the systems we even don't have in India yet, in terms of like on a massive scale, such as like EHR and EMR. They are called electronic health records and electronic medical records, where a patient walks into a hospital, and the moment they check out, all that information is collected into a software database through which a lot of data mining, data analytics can take place. And also you can use some of the engineering skills like machine learning and artificial intelligence to see the pattern waves, to see, okay, if we take like 50 patients together and clutter them or cluster them and then kind of do the group mapping, that is doable. On the medical side, now as a physician or as a medical student, if you have all that data available at a fingertip, you can easily identify, okay, what's trending, what's going on. And using those kind of tools, only the Chinese physician who actually first created a notification and alerted the public health system in China was able to do that by understanding the patterns, by understanding the intricacies of like how that data is getting populated and getting connected across the entire spectrum. So I hope this is kind of like a good overview with respect to the technologies, and we'll discuss more onto this during the Q&A. Moving on. So I did something, this was like a 1 month long project for me. I'm a data science guy along with the digital health. So I like to do pre and post. So I wanted to see how many tools and applications which were out there before COVID-19. So I took a date as like December 1st, because that was the onset, the very first day when, there was like the first positive case of COVID-19 in China. And from there, I went all the way to April 20th, so about 15-20 days ago. And then I took that as like my last date. And I evaluated that how many hospital system, how many, insurance companies, how many pharmaceutical companies were using digital health applications, and how many of them were not using digital health application. And then fast forward, after 3 months, I compared the same group of companies, same group of organizations with the use of the digital health apps. And I saw that there is a massive increase of 73% increase in the use. So that is powerful. That is phenomenal as to how we are kind of, moving into something which we are not used to, which was a kind of like a complementary or a support service back in the day, and now has become mandatory. We cannot live without, like, for example, Zoom. I have meetings back to back on Zooms. We cannot live without digital health apps, where we are able to understand, okay, what's or collecting all the patient data. So many hospitals here in Ahmedabad as well as in Mumbai are now using this kind of monitoring and patient doctor communication to avoid patients coming to the hospital and getting infected, even if, if they were not even positive. So by asking questions, by understanding or by having a teleconsultation, we are able to again mitigate or stop the spread of COVID-19. So this is wonderful as to how we have evolved. And because of that, we are moving from like, a standard hierarchy that, okay, the doctors as well as the nurses were always above the patient, to now coming into an ecosystem where all three of them will take the decision together, which is in the best interest of the patient, not for the doctor, not for the nurse, not for the corporate hospital, but for the patient. Because if you are able to treat the patient in the best possible way, if you are able to transform his or her lives, you are building a cultural shift in terms of working through ethics and working through integrity, which is also very important as we start using all these digital health technologies and empowering patients as we go forward. So what is that? I've talked multiple times about, putting patients at the center, using of digital health. It's all about making that human at the center. What it means is that now the doctors have to put patients first. Doctors have to understand the patient needs from the get-go. Doctors have to have tools and features available at the fingertips so that they know what the latest evidence-based data as to what is evolving, what is trending. They can no longer go back to the 1980s book and say, okay, for this condition or for this thing, you can just do that. So I'm seeing a lot of physicians transforming the way that they are seeing patients, during and hopefully post COVID-19, and which is game changing and life saving for the patients. So how we can do that? Because as we are able to embrace the breakthroughs as to what these technologies have brought forward into our ecosystem, we are able to do it through the actionable data, as I mentioned, along with a proper channel communication. So that, okay, when the patient walks into a hospital, the doctor doesn't have to take too much time understanding the patient needs, because as a patient, now you have inputted all that information related to clinical symptoms as well as medical symptoms right upfront in the application, and have used that to push the notification to the nurse. So the nurse or the medical assistant is reviewing that information and then providing only the succinct or the most pertinent information to the doctor, so that the doctor is able to take the take the decision what is best for the patient, rather than going through lots and lots of data or asking like 20-30 questions to the patient. So everything becomes a channel so that there is a proper one-to-one communication using the tools which are available in the marketplace. And of course, I'll give you a list of all the tools which you can review, which you can kind of go and plug and play, so that you can understand how the patient care, how the hospital patient coordination is increasing and improving day by day. So treating patients as a consumer retailer is becoming a paradigm shift. Funny thing is, like yesterday, I was just like playing with different apps, and I went into an app which we all are familiar with. Is called Swiggy, right? To order food at home. And on Swiggy, while I was just playing with it, I saw that when I was able to do the checkout, or when I was about to do the checkout, it prompted me a notification. Hey, would you like a teleconsultation with a physician, right? So that is something very powerful, that now I'm able to have a consultation with my doc or with my physician, even when I'm ordering a food. So integrating that healthcare, or allowing patient to have direct access to a physician within minutes, not within hours, within days, where you go to your doctor and then they make you wait for 2 hours before they are able to see you. Days are gone. Now I just want everything at home, at my place, during my convenience, whenever I need. So that was really good. By the way, I would say that I have not ordered any food from Swiggy or even Zomato. I was just testing the new features which they are rolling out, and I came across where, you know, a food delivery company is looking into and healthcare company to bridge the gap for the individuals like us, so that we know that, okay, what are our blood you know, vitals, what is our blood test, whether it's normal or not, and that is also through, you know, just sitting at home. So that is powerful, especially in country like India, where the ratio between a doctor and a patient is skewed. What I mean by that is about one doctor is kind of tapped to seeing 10,000 patients over the course of like a month, you know, in a given geographic region. Whereas if we compare that data to some of the developed countries like, you know, Britain, US, or Canada, it's one doctor to 10 patients, or even 100 patients, right? So our doctors are being like exhausted. Our doctors are being bombarded with so many patient requests, patient visits. So now channelizing non-important electives and, you know, selective surgeries or things like that into a digital health application can free up so much time for the doctors to kind of focus on the complex, critical, and acute or active patient cases. So this is only possible when there is more connected relationship within healthcare provider to achieve the goal of like providing a comprehensive, robust patient care, which is empowering for the patient, and it increases the patient outcomes. What I mean by patient outcomes is it's not like a way where you go to a doctor, you get 10 medicines, you take it for 5 days or 10 days, depending upon the frequency of taking that medicine. And then you go back to the physician and then they review, evaluate you again, or they look at your symptoms once again and then kind of change the course of action, or, you know, prescribe more medicine or change the type of the prescription which you had. There is no longer that we should do that. You know, it's more about identifying the patient symptoms, patient you know, challenges or conditions right up front within the first meeting, using data, using understanding of the continual monitoring of their symptomatic information, and then providing the most appropriate evidence-based treatment solution so that it's very effective and it has high efficacy. So that is possible because of all these tools. That is also possible because of the evolution in learning and deploying of those applications. And that can only lead into the better patient care experiences. So I say this, it's like that collaboration, you know, we all talk about let's collab, you know, let's connect, you know, let's work together, let's do research projects together. But it's no longer that. You will have to do collaborations of collaborations. What I mean by that is, you know, a patient should not be carrying the file, or, you know, we get that file when we go to a clinic or a hospital here, from like one center to the other center. You know, all these private institutions, all these private medical providers, and all the government hospitals need to create a framework, need to create a platform through which, you know, as a patient, you know, you are at a free will. So for example, I'll tell you, when we go for movies, we go to anywhere, right? All that information is preloaded, it's available wherever we are going. We are not carrying a file with us. Just like that, I imagine a day where in India, where we can go from like, walk from like one hospital to the other hospital system, and all the patient data, all of my data is available, right? And with date, stem based, which doctor saw me last time, so on and so forth, so that the next doctor can understand the entire history of mine in a clear, succinct way, so that I don't have to repeat my entire history again, or I don't have to worry about forgetting my files, you know. So not only between that, but now we have to take to the next level. It's like connecting that with radiologists, pathologists, you know, labs, so on and so forth. So that is only possible where we put patient at the center. That is only possible where we look at the collective collaboration, where it's not just about like me making money or me seeing like 1,000 patients a day. It's about us working together, seeing not only 1,000, but now 10,000 patients together so that every patient gets a customized, personalized care while getting the latest and the best treatment possible. And because of COVID, I've seen significant changes in terms of how the healthcare practices are working. Now our workers have a lot of toll in their lives. It's like they are doing 6 hours, 8 hours, 12 hours non-stop duty, wearing the entire PPE kits with the N95 mask and so on. And it is affecting not only the physical health, but the mental health. So during this time, the technologies like this can be very helpful to provide a proper mechanism with respect to like scheduling of your healthcare workers, forecasting the need of the patient or the cases. Another thing is like we are diminishing the trust in the global world, as our Prime Minister just mentioned 2 days ago, that India has to become self-reliant, self-sufficient. Right, so we no longer trust what we are getting from other countries because we don't know what those individuals or what the packages or what the imports which we are doing will come up with, whether it will be a new virus or it will become much more catastrophic than that. And because of that, we have to focus on the robust digital savvy health systems. And I know that it takes time, it takes effort, it takes a lot of resources, but considering the ROI in terms of the patient care, ROI in terms of the value, it goes far and beyond. And now, during and potentially after the COVID-19, we'll see these 3 major trends. There have been significant talks between all the immigration companies and immigration organizations that we need to issue an immunity passport, where now your health has become #1 factor before you can even travel from one country to the other. So with the onset of like focusing on so much for our health and wellness, we have to keep in mind that we track and monitor all of our healthcare symptoms. And then, surveillance. There is ongoing surveillance. In my phone, I have Arogya Setu app, which is like monitoring like my location using Bluetooth, and which is also checking my vitals or my questions if they have changed over the past couple of weeks. So that is amazing, through which we are able to not only survey just one part of the population, but across the entire country. And then the new lifestyle measures, which we all know about, I wouldn't go much in detail, but where now we are even more focused on like not just like directly connecting with another human being, but rather take all the precautions so that there is no infection from like one end to the other end. And then these are like my must-haves. This is something which must happen after COVID-19. The more utilization of artificial intelligence, understanding the pandemic crisis, and doing that surveillance so that we can prevent what has happened today in the coming times. This you can consider that it happened, we were not aware of it, or we were not equipped with, but we have learned our lessons, and we have to do the very best to make sure that history doesn't repeat itself. And then we have to provide point of care solution. Days are gone when you expect patients to walk into a hospital and spend 2-3 hours to see their physicians. We all want everything at our home, right from like banking, finances, to all the way to food delivery, to all the way to even like our lifestyle needs, such as like haircutting, facials, spas, everything. And everything is coming at home. So why not healthcare? Why should healthcare lag far behind the communication or the digital revolution? And that is where we have a lot of opportunities. So if you are thinking about, okay, I want to do something, I want to create something, I want to start something, think about put yourself as a patient at the center, and think about what are the challenges you are facing today to avail your healthcare services, be it like your vitals, be it your daily, communication with the physician, or your annual health checkup, or anything like that. And wherever you see the missing points, wherever you see the pain point, wherever you see that the system is broken, that is where you start, and that is where you create an opportunity, which can create in both the social impact, that is transforming the lives of the people, as well as the economic impact in terms of creation of jobs, in terms of transforming the way we are able to do business between a doctor and the patient. And then I will just leave you with like one example. So at Adani, and again, this is not like we don't sell anything with respect to healthcare to any of our any other hospitals or any vendors. We are not B2C or B2B. We are just doing internally for all of our employees. We have over 35,000 employees plus contract workers plus third party folks across like 22 sites and all different locations across pan India. So how we can bridge the gap where any of our employee who is stranded at a very remote location with no internet connectivity, working at a plant or working at one of the transportation sites, how can they connect with our doctors who is sitting at the corporate office and can share about the journey or share the challenges that he or she might be facing? And so we are building a digital, robust, tech-savvy health and wellness dashboard where we are able to empower the doctor-patient relationship, where we are able to let our employee know, okay, what is the health insurance coverage, where they should go, where is the nearest location for them to do X, Y, or Z, how can they have the virtual consult with a in-house physician, if they need specialists, how can they connect with our network providers, what are the things that they have to keep in mind at the remote site, providing them with compendium in terms of like the frequently asked questions, with empowering, also making them aware about, okay, what are the common things that they should know of, or the preventive measures that they should take during this pandemic crisis. And there is a ton more into this, but due to as it is like proprietary, I can't share much. But when a company like this is able to undertake and understand that, okay, employee health comes first and foremost over doing businesses and making profit, because if the employees are not healthy, if the people are not healthy, then they will not be able to do other things, and that will have a detrimental impact into all the corporates, into all the companies, as well as academic institutions. So health is wealth now in a true sense. And then here is like something which you can explore, some of the digital health companies in India which are making waves during this unprecedented times. And disclaimer, I'm not affiliated with any of these companies, just that I've evaluated them, and I know that they have built the robust technology platforms where they are able to solve one of the challenges, as I mentioned, and also provide it on a larger scale. And then the next, I will leave this talk with the challenge and then open up for the Q&A that, are you going to just engage in the difficult task of health change? That means, are you going to do something pretty different than what we are doing every single day, so that, we can impact and we can adapt innovative digital health technologies for our group, and so that we can improve people's life? Or are you just going to stay the same, not change, and be as is? So that I know that we are innovators. I know that we are spending this time this afternoon. All of us are profoundly committed to making shift and creating digital transformations. So the future can look like this. This is kind of like me, my avatar, where I want to have a world where it is like interconnected, digitally available. Every information is at the fingertip, and we can do the best what we can. So last but not the least, the future is not about just having a technology, right? I know that you might be thinking, this guy like just came and started talking about tech, but it's not just about that. It's about the human experiences which this technology enables. Think about, if all of my data, all of my symptoms are available to my doctor at their fingertip, I don't have to think about, okay, what are the things I'm going to tell my doctor today? I don't have to take all my notes. I don't have to take my files, and then my experience with my physician is much more empowering, much more as a friend, rather than, who is this guy asking me like 20 questions? And for the doctor, why did this patient didn't bring the file? I want, like, we should avoid those kind of things, so that there's a one-on-one significant superfluous communication between a healthcare provider and a patient who needs the care. That's it. Thank you very much, guys.
Thank you, sir. Really, it's a mind-blowing presentation, and you are a futuristic person, sir. You have a very good opinions about what the medical technology will going in the future, And I have a few questions to you, sir. Okay, behalf of audience.
Sure.
Yeah. The first question is, how can someone get started in digital health?
Yeah, so digital health is up and coming topic. When I was studying back in the college, there was no concept like that. And so, but it has becoming the need of the time. So I would say that the way, someone who is like in the adjacent field, not mainly in the technology aspect, can go into like some of the online learning programs like EDX or MIT and Stanford universities have courses available, so that you can understand 101, you can understand one-on-one about digital health. You can also do a simple Google, and then you will see Wikipedia pages, you will see some of the institution and companies working on the onset. And then if you talk about digital health in itself, it's a pretty big scope, right? Because within that you can work on the devices, within that you can work on the pharmacy or the medicines, within that also you can work in the form of ERP, which is enterprise resource planning solutions. So it's not just that like if I study about digital health, I'm like great. You have to find your niche, or you have to find where you can provide your strength and sweet spot, right? So for example, for me, it's about connecting a patient to a doctor. And I know that it's very simple. It's much simpler than done. What I mean by that, when I say connecting doctor to the patient, I know that everyone will be like, yeah, that's so simple. But there is a lot of intricacies, there is a lot of nuances linked to that. So just start doing Google. There are some courses which you can take. And with the lockdown, rather than being a lot bogged down, that why I'm like at home, why I'm not able to do this or do that, and having a complaint mindset, take an advantage of doing something new, learning something new, not necessarily digital health, but something which as a student, which as a faculty, you always wanted to do, right? And that is how you can add new knowledge to your day-to-day life.
It's a very, very nice explanation, sir. And is it a kind of what frameworks do you use for evaluation of digital health products, sir? Do you have any specific framework? Because in a computer science and those things, we have a specific frameworks to work, as a group or team model. Is there kind of any framework for digital health products?
Sure. I mean, that's a great question. As a doctor or as a faculty, you don't want to just use any application, right? Because at the end of the day, we are seeing patients, and the objective is to save patients' life. So if you use a technology which is not clinically validated, that is one of the framework which we use. What I mean by that is you take that app or you take that technology, okay, and kind of do that clinical trial, but in the digital way, okay, and see the effectiveness and the efficacy of that. So I'll give you a short example. The company in which I was as a startup founder back then, before joining Adani, we built the tool. And as like a newbie entrepreneurs back then, we were like, yes, now we'll go to all the hospitals and all the doctors will start using it. But it's not the case. We started seeing, okay, what are the things which we need to incorporate into these tools before it becomes more meaningful and applicable to the healthcare community. So we conducted a clinical study, we did a patient focus groups, we did a doctor focus groups, we evaluated using the evidence-based guidelines which were out there in that specific condition like epilepsy. And then we merged all those things together, gave it to the 10 physicians to evaluate based on their experiences, evaluate based on their scientific knowledge. And then they all came back and said, yes, this is great, this is great, this is great. We tweaked a little bit. We made sure that it's also safe and secure. Security is a big constraint. One of the things which I had it in my slides is about cyber security. When you're communicating online, there is a possibility that someone can steal that information. And especially in the patient doctor world, every patient data, it's very valuable and it's very important for the patient, for us to keep it private and secure. So you also have to test your application and tools on that aspect. And then when you merge all of that together, that becomes your standard framework to go forward before you can bring it into the marketplace.
Okay, I mean, from your answer, I have a one question.
Sure.
That is what is the status of the current research on privacy and confidentiality of health information in especially for developing countries?
Yes, that's a great question, and we are always battling with that. So if we talk about the US, Canada, and Britain and Australia, these are the 4 countries where they have the best HIPAA compliant, which is called Healthcare Information Portability Action and Actionability Act. What it means is that you keep your patient data confidential at every cost, right? At no cost, it should be leaked. Otherwise, there is significant penalties, fines, and also sometimes the companies are being shut down. So that is, we are not there yet. We are not robust yet. Despite us knowing that security is of the prime challenge, I'm seeing doctors connecting with the patient on WhatsApp. I'm seeing patients connecting with the doctors on Facebook, right? And those are not the communication channels which you should use when you are talking about your condition. That's why if you talk about tools like I wrote over here, I'll bring it back. If you see about the tools like telemedicine tools like these 3 companies, they're investing so much time, resources, as well as they're hiring cybersecurity professionals to make sure that the chat or the video chat or the digital text chat is compliant, where that data just stays within their own cloud enterprises, completely confidential, so that it's not accessible by other parties. So I would say that compared to like other countries, we are about 20% there and 80% still to go. So if you're thinking about an opportunity in digital health, that's one of the way on securing doctor-patient communication.
So this is the responsibility of the physician also, right, sir?
Yes.
Okay.
Definitely.
Okay, sir. And now come to the corona virus problem. So many persons nowadays we can see the chatbots are everywhere. Okay, each and every institution they are creating a chatbots. Whether they really it is useful for to fight against the coronavirus, sir?
Yeah, I say that definitely those chatbots were clunky, were not working at first. You know, they are AI based. What I mean by that is adaptive. They will ask the next question based on the answer to your previous question. And then they use the logarithmic modules where, okay, if you have this and that, like what are the likelihoodness that you will have COVID-19, or you should definitely consult the physician today, you know, and then that is determined by creating a gold standard we are able to create using AI based tools like random forest or those kind of things, and then you can see okay that whether it is evolving or not. And also on the database on the other side, you also have to make sure that all the guidelines which are being given by WHO or Ministry of Health and Family Welfare in India are incorporated as an ongoing basis, because the guidelines which came 2 months ago for COVID-19 doesn't hold true today. It has evolved, it has changed, right, significantly. So the chatbot should be able to incorporate and apply those real measures, real guidelines whenever the patient or whenever someone comes to your website and goes through that Q&A.
Okay, sir. My questions are almost over, and I will ask one question on behalf of Srimati Madam. She is asking a question like, is there any scope for telemedicine linked with the online paramedics? I mean, she has also explained the question. Can we link telemedicine with online paramedics? But online paramedics don't have clearances in sale from government. But when we link these both, she is asking that question.
Yes, I mean, you can link paramedics through telemedicine, and that can become a very applicable solution. Whenever we talk about telemedicine, especially in India, it's still in the infant stages. We always think about, okay, a doctor is on the other side, and then the patient is on the other side, and they both are in one room, right? And then they are having the consultation, like how I'm communicating with you guys. But when we talk about the paramedics, they are always on the go. So one of the thing is, first we have to make sure that the connectivity is great, at least 4G LTE. Second, the paramedic knows how to use that tool or the applicability during that, like where every second matters. So the application for paramedic should not be as comprehensive, should not be detailed oriented like other telemedicine tools. It has to be simple. Paramedic doesn't have time to type the condition what the patient is having. There has to be an availability or an option for audio to text. There has to be an option where with one click, the app understands, okay, what this paramedic needs or what the app should do to help the paramedic, right? So you have to, because over there, if the paramedic is on the app trying to input the data, and if the patient pass away, it will become, then the digital health will be laughed at. So it should not be like that. So there has to be so many precautions and conditions to be applied before it can become widely adopted.
Hello.
Yes.
Yes, sir. Rajkumar sir was continuing with that. I'm just checking with the chat, sir. If any query is there from the participants in chat books, I'll just finish it off. There's one query from our participant, Moni Madeshwaran. He has asked, a possible roadmap shall be to develop healthcare informatics professionals for urging in a paradigm shift.
Sujit, can you please repeat the question again?
1 minute, sir. I'll make the participant itself to talk. Sir, I can unmute you, Moni Madeshwaran, sir. You can ask your query with the speaker, sir.
Definitely.
Am I audible?
Yes, sir. We can hear you, sir.
Okay. Thank you very much, Mr. Neil Mehta. You had a very good, very nice insight into the digital health and technology.
Welcome, sir. This is Kanta.
Hello, madam. I am participating because of your WhatsApp message.
I didn't want to disturb you during that time.
Okay. Thank you very much. And see, during this Corona period, now everybody is talking about alternate medicine.
Yeah.
And health informatics is now a One Health Eco Health system, and we have to move from these the present healthcare systems to the human health informatics and plant health informatics, animal health informatics, soil health informatics, water health informatics, and fish health informatics.
Yeah.
So my recent article on health informatics, a quintessential development strategy for, you can read the title, I can send it to you, for achieving sustainable society in India, and is essential. So the National Health Informatics Network has to be redesigned. Yeah? Because nobody is looking into the zoonotic diseases. 85% of the disease which we get is from the animal.
Yeah.
There is a quarantine on that side, and this budget we spend for human health can be meaningfully spent. And even coronavirus also is from the other side. So I have been voicing for for the last 10 years, and then we have a lot of students with a biology background.
Okay.
More than 25 digital technology can be adopted. And in a new paradigm shift, why don't we bring this, total, integrated health management informatics, which also takes care of farm health management, because the food which we eat should be, should be able to ensure our health.
Yeah.
And today, computer science students are not being taken internship in health informatics side, and which generates a lot of data, but this data is not getting analyzed. Doctors don't have time. So I even visualized and propagating, why don't we have an MSc Health Informatics program or BSc Health Informatics programs to generate large scale, employment opportunities in the rural area.
Sir,
So
can I say a few things,
what is
sir?
needed is that, some biological capabilities and then the IT capabilities.
Yeah.
With
Sir,
artificial intelligence and so much, about more than 25 technologies which are available, but the data gets generated, but we are nowhere near the, the sustainable society, which is called society for 5.0. So, that's why as soon as Professor Ganta has sent this art, link, I thought that I should participate. And if you want, I can send this. I noted down your WhatsApp number. I will send this article. I'll be very happy that you can.
sir, the society is still compartmentalized, sir. They are not open-minded to bring all this integration. That's a problem.
Yeah, that's.
Who will bring the
I'm the
link
person who worked for
and put this
agriculture,
together?
informatics, and food management. And now the health informatics. And see, computer science and information technology has to walk together with other discipline.
Yep.
Because today it's everything data.
Correct.
And our educational system is not, is not even, is vertical, compartmentalized, but they don't even want to talk to each other with a strong network which we have.
That is true.
So, and then this is an important thing that if we look into rural India is agriculture and health. And
Yeah.
Nothing more than that. If what a Honorable Prime Minister says that self-reliant India, see, 2002, I come out with a scheme called Smart Village, which is didn't see the day of the light, light of the day. And today we should achieve self, rural India is self-India,
Yep.
So health is more important component. And if 5 components are put together, I think we have achieved it. That is the paradigm shift to which we should bring it. And, I'm very happy and thank you very much, Madam Professor Ganta, for sending the link, and we will interact. Thank you very much. I have to join another conference. Thank you very much. Thank you.
Thanks, Moni. Thank you so much.
Thank you.
Sujit, can you ask other questions? Otherwise, I will ask it. So the question from Nihela.
Okay.
The question is, will you pass? I mean, what is the principle of Arogya Setu app?
Yeah, so the principle of Arogya Setu app is to identify each individual across India, whether they have any likelihoodness of having COVID-19 or getting in contact with someone who has or had COVID-19. So the way it does that is by asking you about 7 to 8 questions in the app, and based on that, it determines what is the likelihoodness, right? So on the back end, you have a database which shows, okay, if a person has traveled internationally, which was the case when the lockdown actually started, it's no longer there. But now if we talk about, it's more about red, orange, and green zones. So every city or every district has those zones. So it identifies, okay, do you live in the red zone? If that is the case, okay, let's ask you the next question. Any neighbor or anyone in your own apartment complex have COVID-19? Then if you say yes, then you are more likely to be in touch or in that synergy or in that area. If you say no, then it will ask you, have you gotten in touch with COVID-19, any patient? Then have you visited any hospital in the last 14 days? Because I would say the incubation period for for coronavirus is about 14 days. So we have to make sure that the person who is a suspect or the person who actually has COVID-19 stays away from everyone else for those 14 days until they are cured. So the Arogya Setu app uses Bluetooth-enabled geo-tracking location to keep you aware about what is going on within your community and around you. so that you can make sure that you don't get in contact with someone who can give you COVID. That's the entire goal of COVID-19 from the digital health, from the technology perspective. Apart from that, it has become an educational resource where we are able to learn more about how many cases the country has, what is trending, what are the things which we have to keep in mind so that, we can become an educated citizen.
Yes, sir. These are the questions. Thank you very much, sir.
Sujit, I just got one question over here. If
Yeah.
I may ask, if I may share.
Yes, sir.
Yeah. What is the future? So Ritesh has asked me, what is the future of mental health services in India? What are the parameters and features in an online service provider should take care? So to answer the first question, which is the future of mental health services. So I would say mental health is inevitable. We live in such a stress and fast-paced life that all of us in one way or the other is having any mental health issue. Don't take it that each one of us has mental health issue. What I mean by that is that we, along with keeping physical health in place, we also have to keep our mental health in place, right? And that's why there is more and more trends to do yoga, to do meditation, to do other things, asanas and all, so that we can have a spiritual living in terms of where we balance both the physical as well as the mental health. If we do not take care of our mental health, then we get into something called mental health issues, right? And so it's again like I would say it's a spread, and we as an individual identifies where we are in that spread. So there is a lot of big future in mental health. One of my really good colleague out of Pune, Dr. Nayak, is working on mental health initiatives and coming up with new tools and technologies to bridge the mental health providers with the people who want mental health services. And then moving on to your next question, what are the parameters and features in an online service provider should take care of? So the same features, I would say building a tool for mental health is even more challenging and difficult than just a physical health tool. Why? Because in mental health, you typically how it has been done to date is face-to-face interaction. A person will go to a psychologist, a person will go to a mental health physician, a person will go to a psychologist, mental health physician, and other fields. And then they will share about the challenges, or even like a social worker in some cases. They will share some of the challenges in an in-person setting for over the course of 30 to 40 minutes. And then after listening to everything, the expert or the specialist will share, okay, what are the things that you have to do if it is like just a conversation interaction. If it is like a clinical intervention, then appropriate mental health medicines will be provided. But people misuse those medications. People misuse that information to the greatest extent, right? Because they just like doing that. And that's why security is of a big issue. And that's why all the parameters and everything needs to be followed with the standard care and with all the security protocols, including something in technology, we say 256-bit encryption. Hope that answers your question. And guys, if you have any other questions, I've given you my website. You can connect with me on social media, or you can even WhatsApp me to the number which is on this slide.
Sujit?
Okay. Yes, sir.
Okay, thank you very much, sir. As a faculty from computer science engineering, we got in so much inspiring, and everyone attendees, they got inspiring from your words and answers. And thank you very much, sir. We will have a session, okay, in future also.
Yes, thank you so much, guys. Thank you for having me. Have a wonderful evening and take care.
Thank you so much. Thank you so much to the speaker, sir, and the moderator, sir, and to the participants for being throughout the webinar. And we'll meet back for tomorrow's webinar at 3 p.m. Thank you. With this note, I'd like to close today's session. Thank you.